This is Hayden Baker with the Hospital Specialist Surgery, narrating our technique for a acute LCL repair. As you can see here, we've done a standard lateral approach to the knee. We identified split the IT band, then identified the LCL and have released it from its insertion on the fibula to simulate an injury. We've then whip stitched it. We also identified the common peroneal nerve, and we'll plan to protect it throughout the remainder of this repair. So the next step in the repair is to drill our tunnel for our LCL button. So we're starting anterolaterally at the head of the fibula, right at the insertion of the LCL, and drilling posterior medially, as you can see here. Let's use this retractor to protect the common peroneal nerve back here. Next, after drilling our tunnel, we pass the button through our tunnel. As you can see here, we've passed it beyond the medial cortex. You can see it here. The common peroneal nerve is to my left under my retractor. We then will flip the button. After flipping the button on the medial cortex, we've now cinched down our repair, reducing the LCL to its previous attachment position. Next, we're drilling a second tunnel more proximally from anterior to posterior across the fibula. As you can see, we've passed our internal brace from anterior to posterior through that tunnel we drilled. And next to it, we have our LCL cinched down but not final tightened. I passed the sutures from the repair stitch through a mini cortical button, and at 60 degrees of flexion neutral rotation, we tied the repair. After passing the internal brace through the fibular tunnel, we then identified the lateral epicondyle and placed our internal brace anchor more proximally to the lateral epicondyle, as you can see here. We placed the anchor with the knee in 60 degrees of flexion and neutral rotation. This is the completed construct.